This morning, a top medical advocacy group is calling for a Federal Trade Commission probe into the American Psychological Association for allegedly pushing sex changes for your kids. In a 2024 statement, the APA emphasizes, quote, the necessity for access to comprehensive gender-affirming health care for transgender, gender-diverse, and non-binary children, adolescents, and adults, but in a 2025 response, when the Trump administration was in charge, to the Trump administration's FTC, they emphasized that diagnosis does not automatically mean social or medical transition. Now, Do No Harm is calling them out, writing, quote, the contradictory messages which expose the APA for telling federal regulators one thing and gender activists another raise concerns that the APA may be knowingly promoting so-called gender-affirming care for minors. Dr. Kurt Miceli is the chief medical officer at Do No Harm. He wrote that letter, and he joins me now. Doctor, simply put, is the APA lying to the feds?
Well, thanks for having me, first of all. And this is extraordinarily concerning. We're talking about kids that are confused about their gender. These are young children and adolescents who are vulnerable, some of our most vulnerable members of society, and they're confused about their gender. And they're going to psychologists and medical providers who are putting them on this pathway towards puberty blockers, hormones, and surgeries. And that's a real concern. And it's especially a concern when we see a statement in 2024, as you pointed out, that speaks to a pro-affirmation model. And then we see a statement in 2025 to the FTC that says something totally different. That dichotomy should not exist. And in fact, when the APA was asked about the statements, they said they were consistent, and they're just simply not. And we need the FTC, we urge the FTC to take action in terms of investigation to really get at the truth here. And frankly, the APA needs to be transparent. What is it actually telling psychologists, patients, families to actually do? And we certainly would hope that in this sense, we want to keep kids safe from this radical gender ideology.
So why would they create an ambiguity when lives and bodies are on the line here, Doc?
Yeah, in terms of that ambiguity, I think it's unfortunately this notion of telling the public and telling psychologists one thing in 2024 with this radical policy statement versus then telling the FTC something else. And I think the reality is that there's clearly an awareness that medical providers, medical organizations, healthcare organizations that have made statements in terms of the safety of puberty blockers or the safety of affirmation, or in fact, in the case of the American Psychological Association, calling states that have bans on these radical treatments for kids, saying that they're engaged in human rights violations. When you have that radicalization, that is a real challenge and a real problem. And I think that's something that the APA, unfortunately, is speaking to activists with one part of their mouth, and then they're trying to speak to the federal regulators on another part. And that, again, is extraordinarily concerning to us.
Let's say the Democrats retake the White House. Do you expect the APA will revert back to their original policy promoting these surgeries if you have an FTC that is then under Democratic control?
It's a real fear, and it's not just for the APA, it's for other elements of organized medicine. We know that the FTC is not just looking at WPATH, the World Professional Association of Transgender Health. We're also looking at the American Academy of Pediatrics, the Endocrine Society. Again, many of these societies that have issued policy statements and guidelines that are pro-affirmation. I think that's very much a reality. The Trump administration has been very bold on this issue in terms of keeping kids safe, doing the right thing, looking at true psychological supports to help kids through a time of distress, not rushing them into a pathway. And we have leadership at the level of the White House and throughout the administration that, again, is focused on keeping kids safe. If that changes and goes the other way, I think, unfortunately, we might see many of these policies come right back to fruition. And we see that in various states. We see positive movement in many of the red states, and we see movement in the other direction in many of the blue states. And so you do have this split that is occurring. And unfortunately, within organized medicine and healthcare professionals, you often see activists that are moving these associations in one direction, and that's a direction towards more harm for kids. And ordinary doctors, ordinary psychologists really need to come out and to be part of their organizations and to demand some accountability and to demand the fact that we need to return to common sense. We need to return to basic principles of what it means to do no harm and what it means to be that provider for that individual patient. So there's a movement here that needs to happen within organized medicine itself. We need to really look at like the American Society of Plastic Surgeons, who a month ago issued a statement that looks at the evidence.
Yeah, we saw that. We reported on that a couple of months ago, that they kind of backtracked and they've stuck to their current thinking. Just quickly, the APA did tell the Daily Wire that there is no inconsistency here and that both documents that we've highlighted here reflect the APA's consistent commitment to evidence-based psychological care. We will see how it all shakes out. Dr. Miceli, thank you for your time this morning. Appreciate it.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.